Hey guys, thank you for joining. I've got Nan O'Brien with me, our women's health nurse practitioner, and we are going to be talking a little bit about some myths and what is actually correct.
Okay, myth number one, weight loss is just calories in versus calories out.
Guys, I love this one. So growing up in a family who struggled with weight my entire life, even personally is something that I can fluctuate 10 to 15 pounds, and I have to be pretty great on my diet and really be careful about liquid calories as well as the exercise. But I'll tell you, sleep is super important too. If I sleep, I can maintain that much better. But I can remember one of the most offensive things someone said to me, and they're like, hey, if you just eat well, you exercise, you'll lose weight. Well, guess what? That is a myth, as we know.
Total myth busted.
It is myth is busted. So what we have found out is balancing those four pillars that we talk about a lot and getting our hormones, our thyroid, our glucose, our cortisol, all of that in check is actually what's going to help with that. And sometimes it is as easy for people to restrict how much we're eating and then exercise as well, but it's not that easy for all of us.
Right.
Okay, Nan, myth number two, you can outwork a bad diet.
No, you can't. So obviously diet is important, eating whole foods, exercise is important, but you can't outrun poor nutrition or hormone imbalances, just like you were talking about. So you have to make, you can exercise all day long. And actually there's some evidence that if you exercise too much, that can increase your cortisol levels. Then your body wants to hold on to the fat, and then kind of you're shooting yourself in the foot on that one.
Absolutely.
So,
and you can't go into starvation. So if you aren't getting enough calories, you're not getting enough protein. And something big with the peptides, a lot of places are using, if you go somewhere that's just online, you're not getting support by a nutrition coach, an athletic coach, we are watching your in-body, you can actually lose muscle. And so you can actually not like how you look because now we don't have enough muscle. Our skin gets saggy.
Right.
Super important for aging women. It's that we keep enough fat and muscle.
You lose the muscle. The muscle is burning the calories.
Exactly.
And then it's just a vicious cycle.
Absolutely. All right. You want to ask me the next one?
Myth number three, all weight loss is good.
Oh, we kind of touched on this. So losing weight, it's not just about the number. We like the in-body and we love the in-body because that's going to look at your lean muscle versus your fat. Visceral fat is so important as well. That's the fat that's around your organs. So even if you lose 10 pounds and a lot of that is muscle, we actually don't like to see that. So our goal is for you to increase the lean muscle as well as decreasing the fat. Okay, Nan, number four, myth. If it worked for my friend, it'll work for me.
Well, one would like to think that, but no, another myth busted. Obviously, everybody's body is unique and different, and we all have different challenges and positive things about our bodies, but it's definitely not a one-size-fits-all plan. And each person, that's why here at Health is Wealth, it's so nice to have the time to take to speak to each individual and kind of learn about each person's body and how it reacts to different things. So hormonal makeup. You talk about peptides and this, and doing a personalized approach is so important for that. So
there are a lot of patients that the GLP-1s won't work for them. Some of it is we need more, support, whether we have you have addiction to food, just like we have addictions to alcohol, gambling, all of those things too. And sometimes the GLP-1s are great to help with that, but it's not just a one-size-fits-all approach. It doesn't just fix it for everyone. Some people do great on semaglutide while others need more like a tirzepatide. So it is a very individualized approach.
So speaking of peptides, let's go to myth number one about peptides.
Okay.
Peptides are the same as steroids.
No, that is not true. They are chains of amino acids, and they are very similar to our body always makes, and it helps to increase growth hormone. So it's not giving a steroid per se.
Right.
Okay. Myth number two, peptides are a shortcut or magic bullet for weight loss.
Can be very helpful and beneficial, but certainly not a magic bullet.
No.
Definitely myth busted there. They're a tool, a very helpful tool for many people, but you have to combine them with nutrition and exercise and building your muscle and just good habits. And that's really, that's one of the great benefits of them. And they kind of quiet that hunger
food noise,
and then you can actually concentrate on developing those good habits. And when you do that, they're so effective.
Yeah, people have
and
so much
great.
success when they're
Yeah.
used appropriately in a combination approach.
Yeah. Did you?
Yep,
Mine.
sure.
Myth number 3, peptides are illegal or unregulated.
Okay, this is actually very good, guys. You want to make sure you're going somewhere that is a licensed provider. We would prefer that you're coming into office frequently. We like our weight loss patients, or even just our regular patients, to come see us at least twice a year minimally. But when you are on a GLP-1, we do like to do those in-bodies and do them at least quarterly, to make sure that we are hitting the right goals of lean muscle and losing the visceral fat. And then also making sure that you are doing all the right things, because if you're not doing the right things, the weight's going to come back. There are some patients who have true obesity who may need to be on these for a lifetime. And there are some people who can be on them for several months, do all the right stuff, and come off of them and not need to be on them. We've seen that success many of times. And that's our goal, right? Is we want you on the least amount of medication supplements as possible. But they are legal. They are regulated. You do want to make sure we're getting them from a compounding pharmacy who is doing all the right stuff and making sure that we're doing it the right way. That's really important to us. But when you are buying these things off online, I'm not sure who's regulating that. So I do have caution by just buying them online, not seeing a provider, not getting into an office. Just know where you're getting, where the peptides are sourced from.
Very important.
Okay. Yep. Myth number 4, Nan. Once you stop peptides, all progress is lost.
Oh gosh. Well, you kind of just hit on that. It just kind of depends on how it was used, and what kind of habits you formed while you were on them, and if you can continue those on. Very often, most likely, you will continue to reap the benefits of that.
I will say, I think when we are weaning off of GLP-1s, that's also very important. I would not just stop it if you're at a high dose. I do recommend working with your provider and decreasing it. Lots of times we'll do even 5 units per week and see how you're doing, right? We can weigh in, we can check the in-body. But if you're doing all the right stuff, and especially if you didn't have to go on those really high doses, lots of those patients can come off of them. Another question here I wanted to hit on, are GLP-1s safe long-term? And that is something that we don't necessarily know. I mean, GLP-1s have been used for diabetics for quite some time. I know there's continuously studies going on. I think more people being on them now, we're going to find out some more things. I think there are, potential for really great benefits of them, not just on weight loss, not just on glucose and insulin control, but memory, cardiovascular health. We're seeing cholesterol get controlled much better. I think there's more things for us to know, but I do think you should always be having a risk versus benefit talk with your provider and see, do I need this? Should I try other things first? And it's something we'll continuously keep on, educating ourselves on, keep reading the literature, and we'll keep you up to date with what we know. And at this point, feel like, if used in the right way and if you need it, that they are safe at this time. But we do want long-term studies as well. All right, Nan. When you hear people say, I'm doing everything right like I used to, in my 20s, I had no trouble keeping this weight off, but now I've approached 40, I'm approaching 50, perimenopause, menopause. What would you say the difference is?
Oh, hormone. In our 20s, our bodies there's usually a more balanced estrogen progesterone ratio. Once you hit perimenopause, and in that way, I feel like we're in our 20s, we're just more resilient.
Absolutely.
We can
metabolism works pretty well.
Great metabolism. Then as we get a little bit older and hit perimenopause, that estrogen levels start to get chaotic and then ultimately start to decrease. When that happens, you're more prone to insulin resistance, slower metabolism. And so all the things that work for weight loss prior to that, by just cutting out calories or exercising really hard, we kind of talked about it earlier, kind of change. You got to manage your stress to keep your cortisol levels down, because the cortisol goes up, it wants to store the fat. This affects everything. And so your hormone levels are kind of culprit. And so you have to not exercise as intense, but maybe do the yoga, do the walking, still weight training, because we've got to keep the muscle up to burn the calories, the bone density, the all the things.
So Nan, I think the last thing we can kind of touch on is, gut issues can affect metabolism. They're finding out, with our gut, there's so much more. There is, an imbalance of the bacteria that it can lead to troubles with losing weight. If we have a high enough level of Akkermansia, some studies are coming out on that as well to be able to help us to not gain weight, to control our weight. I don't think there's a magic pill or an injection, of course. I think it's all a combination approach. But I think if you are struggling with weight, whether you're a man, woman, if you're perimenopause, younger menopause, reach out to your provider, ask for a full panel to be done. If you're seeing just a traditionalist who may not have as much time to spend with you, find a good functional medicine provider. And there's IFM.org if you need a space to start, because we're here. There's a lot of good functional places around town, and we have got lots of great people that we partner with and we check in with, because maybe they don't do the traditional medicine as well and the annual physicals. They'll send some patients to us and likewise. So reach out, do your research, ask for full hormone panels, thyroid, cortisol, look at the big picture, insulin and glucose, and just find somebody knowledgeable. And if you can't find that, we're here for you. Thanks for tuning in.